So for this video, we're going to be discussing how social workers empower and deliver interventions for vulnerable individuals on a micro, meso, and macro level. Further identify the critical contemporary issues that vulnerable populations face on local, regional, national, and international platforms. To start off, macro level social work is interventions provided on a large scale that affect entire communities and systems. Meso-social work happens on more of an intermediate scale involving neighborhoods, institutions, and other smaller groups. And micro-social work is the most common, which usually happens between the client and or the family. Macro social work is the effort to help clients by intervening in large systems. Examples are lobbying to change healthcare laws, organizing a statewide activist group, or advocating for large scale policy changes. Meso social work practice deals with small to medium sized groups. Meso work is often targeting smaller issues within larger social issues. In micro social work, the social work engages with the individual or families to solve problems such as finding houses, healthcare, family therapy, and other social services that could be offered. However, using the term vulnerable is typically used in regards to the poor, the medically unserved, the chronically ill, those with disabilities, those with mental illnesses, those with alcohol and substance abuse, and immigrants. However, sometimes vulnerable people could be a religious-based group, gender-based, sexual orientation, and gender-based. I actually found this chart that was useful from the U.S. National Library of Institution of Health. It's color-coded nicely. I'll bring you in so you can see. So it's showing a scale of vulnerable people. So we're looking at sexual orientation, which we'll talk about later, some gender, and employment status, religion will come in, and disability status. The FBI has defined a hate crime as a criminal offense against a person or property, motivation in whole and part of an offender's bias against race, religion, disability, sexual orientation, ethnicity, gender, and gender identity. Hate itself is not a crime, and the FBI is mindful of protecting the freedom of speech. Obviously, they had to put that in. They aren't really taking away your voice, just more so if the voice kind of comes along with some criminal offenses, but you're always valid to your opinion. The FBI hate crime statistics from 2007 show that the 6 most common local locations of sexual orientation biased crimes is in a residential or private home. I believe it would be 40% actually happens in your private home. 24% of the crimes occurred on streets, highways, roads, and back alleyways, and 11% occurred at schools. And then along with 7% motivated hate crimes occurred in parking lots or those garages. Across the nation, vulnerability can be based on gender as women experience unequal pay. Actually, statistics proved by the Institute for Women's Policy Research says that in 2018, women only made 82 cents to every man's made dollar. On average, women earn less than men in nearly every single occupation. The IWPR has been tracking the wage gaps over time and estimates it will take about 40 years or until 2059 for us to have equal pay. However, with an analysis of federal data, they stand by saying equal pay would cut poverty along working men and women and their families by more than half and add about $513 billion to the national economy. However, yet for Hispanic women, it is an estimated of wait until 22-24 for equal pay, and for Black women until 2119. So as of right now, we're in 2019. So that is 100 years of waiting time for equal pay for African American women, which is ridiculous. However, an international issue would be healthcare coverage, as I previously went over in a video before this. Diseases such as Ebola and Zika took over the lives and contributed to the deaths of thousands. In 2016, 1.8 million people were newly infected with HIV. Your everyday diseases or conditions such as diabetes, cancer, are killing people because they cannot afford treatment or their insulin. Women are having unsafe childbirth, abortion, men are having unsafe sex, and lack the knowledge of possible contractable diseases or infections. Um, Even though it is illegal at times in hospitals or caring facilities, nurses, doctors, assistants in general, at times will neglect, ignore, or even deny the individual of basic care due to their race, their gender identity, their religion, so on. And in my opinion, they should lose their jobs or license. I hope you enjoyed my video. That concludes the vulnerable population video.